Hey everybody, today we're going to be talking about the big D, vitamin D. We know that everybody's been hearing about this, so I want to give you a little bit of help. So the first thing we're going to start out with is a little quiz. So have you been checked for vitamin D deficiency? Have you had a blood test that's checked your levels of vitamin D? I know many people are taking vitamin D, but maybe you haven't gotten your levels checked. So this is what we're looking for. If your levels are between 60 and 80, you're doing awesome. But if your levels are between 40 to 60, we could improve a little bit. And if your levels are between 30 and 40 in functional medicine and optimal ranges, you're on the more deficient side. If you don't know your levels of vitamin D, we need to definitely make sure that you're finding out if you're taking supplements and if you're not taking supplements, and you're going to learn why. So if your vitamin D levels are lower than 30, you are truly, truly deficient. So this is the deal. The people with low levels of vitamin D are twice as likely to have diabetes, 40% more likely to have high blood pressure, and about 30% more likely to suffer from a heart attack. Now, those numbers are really crazy, aren't they? So why are so many people deficient in vitamin D? So number one, it's recognized as a major problem for adults over the age of 50. And honestly, this is the only thing I can say 100% of. 100% of everybody we've tested in our practice has been deficient unless they're supplementing. And so 90 to 95% of people are deficient in vitamin D unless you're supplementing. And it's estimated that 1 billion people worldwide across every ethnicity and age group have a vitamin D deficiency. So why are so many people deficient? So we can only get vitamin D from the sun, from the UVB rays. And the UVB rays are the highest between 10 a.m. and 3 p.m. during spring, summer, and autumn. If you're not outside during those times with your skin fully exposed, you're not getting enough vitamin D. The clouds can eliminate up to 99% of that UVB radiation. So even if you are outside during that time, you might not be getting it. And there's been a marked decrease in the UVB during winter months. People wearing sunscreen is going to absorb, the sunscreen is going to absorb the UVB and some of the UVA. So the sunscreen is going to block your vitamin D production, especially any SPF between 8 and 15. It will reduce your ability to absorb the vitamin D 95 to 98%. That's huge. And if you're taking certain medications, it can also decrease your absorption of vitamin D. Now, people with darker skin, they have more melanin in their skin. They can't absorb vitamin D as easily, and it interferes with the cutaneous synthesis of the vitamin D. That's how it's made on your skin. African Americans with dark skin tones require 5 to 10 times more amount of sunlight necessary to produce a similar result in someone with lighter skin. The other problem is people who are obese, they'll sequester the vitamin D in the fat, and they require a higher dose to have it increase their levels. So in some people genetically don't hold on to vitamin D, so they require more of a supplementation. And so technically vitamin D is not a vitamin, right? What's a vitamin? It's an essential dietary factor. Vitamin D is a prohormone and is produced photochemically in the skin. In other words, it comes from the sun. But we can get some vitamin D from food, a little bit, right? So from fatty fish like salmon, tuna, mackerel, fish liver oils, beef liver, cheese, and egg yolks. But we're not going to get very much. Even the food that's fortified with vitamin D, we're not getting sufficient amounts. So the best place to get it is going to be from supplements. And we're going to talk about how much and who should take it and why. So what are some of the benefits of vitamin D? Now, I got to tell you, these benefits are crazy, crazy good. So it reduces metabolic syndrome, insulin resistance, and it even helps with type 2 diabetes. There's tons of studies out on vitamin D. And during COVID, those studies have gone crazy, really increasing to know more benefits of vitamin D. It decreases risk of cardiovascular disease, stroke, hypertension, hyperparathyroidism. It reduces osteopenia and osteoporosis, that's the bone loss. It helps with musculoskeletal weakness and myalgia. As a chiropractor, we're seeing people who come in pain all the time. And if they're vitamin D deficient, that could be contributing to the pain. It decreases certain types of cancers. It decreases the spread of certain types of cancers. It helps with weight loss. It reduces the effects of depression. It supports autoimmune diseases and Parkinson. It bolsters your immune system and prevents colds and flus. It assists in wound healing. It helps young children prevent rickets, and it helps with benign prostatic hypertrophy. Now, I don't know about you, but that list is huge. And sometimes when I see a huge list like that, I'm a little suspicious. So I got to tell you, I have looked up studies on every one of these things, and the results have been amazing. So vitamin D really is what it's cracked up to be. So what levels should you have? So the lab says if you're below 20, you're technically deficient. If you're between 21 and 29, you're insufficient. And if you're greater than 30, they say it's sufficient. And toxicity if you're over 150. Now, this is if you have the lab done on your serum. For functional medicine, our optimal health range, we want you between 60 and 80. That's going to be your best place. Now, people will say, well, how much should I take? And it depends. It depends on your skin tone. It depends on your size. It depends on your genetics. So the best way is to get your vitamin D checked, take the dose that I'm going to tell you, and then recheck it again in 3 months, because we're going to talk in a minute about toxicity. You don't want too much either. So if you take 1,000 IUs of vitamin D a day, it will increase your levels in your blood over that 3 months. Each month, it will increase it by 10 nanograms per deciliter. So now the other thing is, if you're exposed to sunlight and you take all those, clouds away and no sunscreen and all of that, in 5 to 10 minutes per day, if you're out between 10 and 3 and you're Caucasian, right, you're going to get some exposure to vitamin D. If you have darker skin tones, you can double that time, but you're not going to get enough to get you up into that 60 to 80 range. Now, if you want to look at based on weight, if you have 35 IUs of vitamin D per pound for your weight per day. So that's a good way to do it. The thing that I don't want you to do, I don't want you to go over 50,000 per week. And that's because that's the prescription dose. And we know that that's been studied. So what about vitamin D toxicity? This is a big deal. You can take too much. So if you get excessive sun exposure, excessive food intake, those do not cause vitamin D toxicity. You can't get too much from food or for sun exposure. And most of the toxicity comes from taking high amounts of supplements. And too much vitamin D can lead to hypercalcemia, vascular and tissue calcification, damage to your heart, kidney stones, and hardening of the arteries in the blood vessels. So we don't want any of that. So the symptoms are unlikely to appear if you're taking less than 10,000 IUs a day. So as long as you're taking less than 10,000 a day or less than 50,000 a week, you should be okay. But I still want you to get it measured. And remember, it can be cumulative over time. So who shouldn't take vitamin D? There are some contraindications. So people who have granuloma type diseases, tuberculosis, sarcoidosis, metastatic bone disease, or Williams syndrome should not take vitamin D. So that's it. That's what we're covering on vitamin D this week. If you have any questions or if you're excited about this information, be sure to comment below, subscribe, comment, share, and we'll be seeing you soon in our next video. Thanks. Bye-bye.